The European Commission has launched a global campaign to find a cure for the coronavirus. It says research must be supported by global cooperation if the effort is to succeed. In just a few hours, the EU secured $8 billion in pledges, contributed by world leaders to accelerate the hunt for a vaccine. $1 billion will come from the EU itself, which the Commission President says will also go towards developing tests and treatment for COVID-19.
The 4th of May 2020 will mark a turning point in our fight against the coronavirus. Because today the world is coming together. Governments from every continent will join hands and team up with global health organizations and other experienced partners. The partners are many. The goal is one: to defeat this virus.
World leaders from 30 countries dialed into the summit, announcing their pledges one by one via video link. Norway committed $1 billion. Angela Merkel and Emmanuel Macron pledged $500 million from Germany and France each, while non-EU members from the UK and Japan to Saudi Arabia and South Africa vowed to contribute too. Our Europe correspondent Gavin Lee sent this update.
It's probably no coincidence that the people who make Eurovision, EBU, and it's not on this year, perhaps it makes up for the fact that there was more than a nod, I think, to the way that they were doing this, with Ursula von der Leyen crossing from Paris to Germany, saying merci, gracias to the French and Spanish prime ministers, many technical problems in there as well. And ultimately, every time she crossed to one part of the globe, it was either a pre-recorded or a live pitch. There was a message from the leader, for example, Emmanuel Macron, the French president, saying that this has to be for a vaccine that is universal for everybody to use, and this $7.5 billion or $8 billion has to be something that everybody can access and it's affordable. But with that came a pitch from every single country.
Well, one country notably absent from the summit was the US. The Trump administration says that thanks to its own efforts, dubbed Operation Warp Speed, the US is working urgently to develop a cure for the virus. Well, last night, President Trump predicted that American firms would develop a vaccine by the end of the year, although he acknowledged the projection was his own and a shorter timeline than the one doctors from his own administration are working with.
We're pushing very hard. You know, we're building supply lines now. We don't even have the final vaccine. Johnson & Johnson, if you look at Johnson & Johnson is doing it. We have many companies are, I think, close, because I meet with the heads of them and I find it a very interesting subject because it's so important. But I think we'll have a vaccine by the end of the year.
Well, earlier I spoke to our State Department correspondent, Barbara Pett-Usher, about what happened when the administration officials were today pressed at a briefing to explain why exactly the US was not taking part in the scheme. This is what she had to say.
They didn't give us a clear answer at all. Instead, we were blasted by statistics about what they were doing and declarations that the U.S. is at the forefront of the international fight against COVID-19, the main international donor. And, you know, the numbers are impressive. They said $6.5 billion if you put together what the government and the private sector is giving towards fighting the pandemic. They said that they were already giving money to many of these organizations for which the vaccine conference was raising money. And that this was not about pulling back from multilateral institutions, quite the reverse, that they were coordinating internationally with the G7, the G20, and that they would continue working together with European partners. So all of that sounded like an explanation for why they should be at the conference, really. I mean, it might have been because of who was there. The Chinese were there, and the Trump administration has really stepped up its criticism of China lately, accusing it of covering up information, crucial information, at the beginning of the outbreak, which then led to it going worldwide. But also the World Health Organization was there, and the Trump administration has cut off the WHO, saying it's not an effective body and that it should have challenged China about the information it was getting. But I'm reading between the lines, Babita. We were definitely not given a clear answer like that. It was not spelled out why the US is not there.
Yeah, I suppose that's all you can do, really, Barbara. But, you know, they have talked about Operation Warp Speed, this vaccination programme. What are they saying about how that is going and, you know, what the research entails in general?
Again, we were told that they were extremely active on the vaccination front, that they had been given billions and billions of dollars, again, both the government and the private sector, towards vaccination development and research on drugs. and so on. And the point was made to them, it's not just about money, of course. This is about international coordination for the development of a vaccine and rolling out the vaccine, and shouldn't the US be there? And again, they came back to us and said, look, we've put out reams of research and resources. So they said 52,000 pages of scientific articles on COVID-19, which were being used around the world. They had unleashed supercomputers that were being used in public-private partnerships with technology companies and with universities, and this had led to dozens of research projects, again, that involved international participation. So we did get a full-throated description of the US being very active on this front, just not being active at a global conference on finding a vaccine.
Now, a raft of countries have started to ease their lockdowns. In each case, a decision has followed the rate of infection beginning to fall. Ros Atkins has been taking a look at what's happening. And it's interesting, isn't it, Ros, to take a look country by country at their different tactics of dealing with this pandemic?
Hi, Babita. Yes, in the same way that the experience of each country has been different and the death rates and infection rates have been different, so the government responses, as those rates have fallen, are also proving to be different. So let's start with Italy. 4.5 million Italians are back at work today after almost 2 months of lockdown. These restrictions are being eased, but only a little. Construction sites and parks are open again, and perhaps most importantly, people can visit relatives, though only if they live in the same region. There's one big difference from life before. Everyone going out in Italy has to wear a face mask. Let's hear from Naples in the south of Italy. Mark Lowen is there.
A nation that has shed so many tears alone can finally grieve together. In Naples today, the first funerals allowed with a maximum of 15 people as Italy opens up. Being unable to say goodbye or visit graves has been one of the cruelest losses of the lockdown. As the world's longest shutdown of the pandemic starts to fade, outdoor exercise is now allowed, parks and some businesses are reopening, and relatives can see each other again with distance and masks.
So finally, people can come and visit the family members that they've been stopped from seeing for 8 long weeks. But it does present a danger because this train has come in from Milan, in the region of Italy worst hit by the virus. So with freedom comes the hugely increased risk of spreading the outbreak.
Keep your distance, they're warned, before everyone fills in a form to explain why they're here. Europe's worst hit country is taking no chances. Livia de Santis last saw her daughter, who lives in Milan, in January. Resisting a motherly urge is tough. Normality so near, yet so far.
So it's very moving.
It's been difficult not to see her.
Yeah, quite a lot. Yeah. Sorry.
But the lockdown has left deep scars. We were taken by police to one of the roughest areas of one of the EU's poorest regions. The worry here is of organised crime preying on poverty. Carpenter Raffaele says with work stopped, he may have to sell his TV to get by. There's been lots more crime since the lockdown, he says, even kids dealing drugs and stealing cars since they need to eat.
The mafia has always exploited Italy's moments of weakness, and this is one of those moments. They give people help, but then ask for drug dealing or money in exchange.
A health crisis has become a social one. And this is what other countries too may face as they reopen from a lockdown that is stopping the dying but killing the economy. Mark Lowen, BBC News, Naples.
Now, as Babita was saying, Italy isn't the only country starting to ease its restrictions. Let's hear next from 4 BBC correspondents in Europe, the Middle East and Africa. First of all, here's Adam Easton in Poland.
Here in Poland, they're reopening museums, hotels and shopping centres like the one behind me, which have been closed now for 7 weeks. The number of customers is limited and they must observe social distancing and wear face coverings and protective gloves. Poland was quick to introduce a strict lockdown, and the number of coronavirus infections and deaths here is much, much lower than in many Western European countries. That's why the government is slowly easing the restrictions to restart the economy. But the number of cases is still rising, and many parents are worried it's not safe yet to send their children back to nurseries and preschools when they reopen later this week.
Here in Austria, all of the shops are now open again, including hairdressers, barbers and beauty salons. And the individual recommendations that people stay at home, except for a few key reasons, have expired, which means that people are free to leave their homes. Although when they're in public, they're being asked to keep at least 1 meter's distance from everybody else. You are now allowed to have an event with a gathering of up to 10 people, but if you want to go to a shop or use public transport, you have to use a basic face mask covering your nose and mouth. Now, if everything goes well, the government says that restaurants and cafes could reopen by the middle of May, but they've also warned that they're ready to slam on the brakes if infections start rising again.
The government in Lebanon has lifted some restrictions on movement and allowed certain type of businesses to open up again, provided that everyone will follow strictly the rule of social distancing. This is part of a 5-phase plan that the government has set out for gradual opening up of the country that will end in mid-June, where even the airports will resume operation. But that's depending on weekly assessment that the government is carrying out on the COVID-19. Here in the capital, Beirut, you can already feel the vibe of the city has changed, where people are going out and about, feeling more relaxed about the situation. But the economy was hit hard. Thousands of people lost their jobs and their income during the lockdown, which pushed hundreds of people into the streets protesting again.
Here in Nigeria, after a 5-week lockdown, the government is reopening the economy, the largest economy in Africa. Beginning from this Monday, here in the capital Abuja, as well as the commercial hub Lagos and Ogun State, banks, construction sites and government offices like the building behind me, Federal Secretariat, are reopening. Markets are partially reopening too. Workers in food processing and agricultural sector are going back to work. But a nationwide dusk to dawn curfew has been imposed. The authorities say people must wear face masks while in public, adhere to social distancing rule and take other safety measures. However, schools, religious centers and parks remain closed, and large gatherings have also been totally banned. As Nigeria eases the lockdown gradually, medical experts are urging caution. The situation is dicey and the virus continues to spread.
But next we turn to Spain. It started a 4-stage plan to get to what it's calling a new normalcy by the end of June. Already small shops and hairdressers are reopening. And bear in mind, it's making all of these moves as its daily death toll continues to fall sharply. Germany too has allowed hairdressers to open, as you can see. People are having to queue with the appropriate social distance. We also know some schools have opened as well. And the country's widespread testing is being credited with helping it to do pretty well in controlling the virus. So things are easing in these countries, and there will be more of that elsewhere in the coming weeks, no doubt. It is, though, helpful to keep a couple of things in mind as we watch this. The first is that this is the start of a new, much longer phase where countries will adapt restrictions according to infection and death rates. To borrow Spain's language, it's a new normal, but let's be clear, it's not normal as we knew it. The second point is that scientists still know relatively little about this virus. We saw this quote from Dr. Ashish Jha of the Harvard Global Health Research Institute. This was in the New York Times. He says, "We're really early in this disease. If this were a baseball game, it would be in the second inning." And remember, there are 9 innings in a baseball game. The point being that this easing of the lockdown is at best the end of the beginning. Scientists and politicians now want to know what level of freedom we can live with without the rate of fatalities increasing sharply again. And Babita, no one is sure what we're going to find out.
Yeah, indeed. Well, thank you very much.